You grab your chest, your face twists, you stagger, your hand shoots out for the wall, misses, and you go down hard onto the kitchen floor, clutching your heart, gasping. Cut to black. That's it. That's a heart attack, right? That's how it goes. Yeah. No. That's how it happens in the movies. In real life, a heart attack is way quieter, way sneakier, and honestly way easier to ignore, which is exactly what makes it dangerous. Almost nobody clutches their chest and hits the floor. Most people are just standing in their kitchen, feeling kind of off, telling themselves it's nothing. So let's clear this up, because knowing the difference, the real difference, is the thing that actually saves your life, and it'll probably stop you from panicking over every little twinge, too. Let's start there, actually, with the stuff that feels scary, but usually isn't. You know that quick, sharp stabbing pain that zaps you for a second and then it's gone? That's almost never your heart. If it hurts more when you poke the exact spot with a finger, if you can point to it, that's a muscle or the cartilage in your ribs. If it gets worse when you take a big, deep breath or twist around or cough, that's lungs or muscles talking, not your heart. And that burning that creeps up after a giant greasy meal and gets nastier when you lie down, congratulations, that's just heartburn being heartburn. Here's a number that should genuinely take the edge off. Out of everybody who rushes to the ER convinced they're having a heart attack, fewer than 1 in 10 actually are. Chest pain has 100 causes: stress, reflux, a pulled muscle, anxiety, you name it. So no, you do not need to dial an ambulance every time your chest does something weird. But, and here's where I need you to actually listen, you do need to know what the real thing feels like, because it's different, and it's almost never the movie version. The real thing usually isn't a sharp pain at all. It's a pressure, a heaviness. People describe it like someone sitting on their chest or squeezing it. And here's the tell that separates it from all that harmless stuff I just mentioned. You can't make it better by changing position, and you can't make it worse by pressing on it. It just sits there, deep, dull, right in the middle of your chest. And a lot of the time, it spreads out to your arm, your jaw, your neck, or your back. And it brings friends. A cold sweat, nausea, shortness of breath, that awful, hard-to-shake feeling that something is genuinely wrong. One more pattern worth memorizing. The real deal tends to show up when you exert yourself. Stairs, lifting something, and ease off when you rest. That on with effort, off with rest thing, big red flag. Oh, and this is important. It can look totally different in women. Plenty of women having a heart attack get barely any chest pain at all. Instead, it's crushing tiredness, shortness of breath, nausea, or pain in the jaw or back. Stuff that's so easy to brush off as the flu or a rough day. Same goes for older folks and people with diabetes. So if that's you, take the quiet signs seriously too. So your actual rule here isn't freak out at every twinge. It's this: deep pressure that won't quit, especially with sweating or breathlessness. Or just that bone-deep sense that something's really wrong and you can't explain it. That's your moment. That's when you stop negotiating with yourself and you move. And that, the negotiating, the waiting, is the part that actually kills people. The average person having a heart attack waits hours before getting help. Hours. Just sitting there going, it'll pass. And here's why that's the worst possible move. Every single minute that blood flow stays blocked, a little more of your heart muscle dies. For good. Doctors have a phrase for it. Time is muscle. The damage you could have walked away from at minute 10 is permanent by the time you hit 90. So the second you're sure this is the real thing, here's exactly what to do. Call your emergency number first. Not your wife, not your buddy down the street. Call the ambulance first, then everyone else. And I know the temptation here. Just grab the keys and drive yourself, right? It's faster. Please don't. If you pass out behind the wheel, now it's 2 emergencies, and maybe you've taken someone else out with you. There's another reason too. When the ambulance comes to you, the paramedics start treating you the second they arrive, and they radio ahead so the hospital's ready and waiting. People who come in by ambulance actually get treated faster than the ones who drove themselves. While you wait, do 3 simple things. Unlock your front door so nobody has to kick it in if you go down. Then sit and stop moving. Don't pace, don't do stairs, don't try to walk it off. Moving just makes your heart work harder when it's already starving. And if you're not allergic to aspirin and your doctor's never told you to stay away from it, chew 1 regular aspirin. Chew it, don't swallow it whole. It gets to work faster that way. Honestly, the smartest thing is to just stay on the line and let the dispatcher walk you through it. That's literally what they're there for. Now here's the one I really made this whole video for. The myth that's been floating around the internet for like 20 years. You've seen the post. If you're alone and having a heart attack, you can save yourself by coughing, hard, over and over, every couple seconds until help comes. They call it cough CPR. Millions of people have shared it, totally convinced they're passing along something that saves lives. The American Heart Association has come right out and said it. It's false, and it can get you killed. There's zero evidence it does anything outside a hospital. The whole idea got mangled out of a procedure doctors used decades ago on patients who were already wired up to monitors with a team standing right there. For you, alone on your kitchen floor, the real danger is you burn your most precious minutes coughing instead of calling for help. So don't cough, call. Okay, last part. What if it's not you? What if you're with somebody and they suddenly drop? This is where one distinction matters more than anything else in this entire video. A heart attack and a cardiac arrest are not the same thing. A heart attack is a plumbing problem. An artery's blocked, but the heart's usually still beating and the person's usually still awake and talking to you. A cardiac arrest is an electrical problem. The heart just flat out stops and the person collapses and isn't breathing. A heart attack can tip over into a cardiac arrest, but they need totally different responses. So if the person's conscious and grabbing their chest, you do everything we just talked about. Call for help, keep them sitting, keep them calm, and do not leave them, and do not let them talk you out of calling. People in denial will swear up and down that they're fine. Ignore it. Make the call. But if they're on the ground, not responding, not breathing right, that's cardiac arrest, and now you are their entire chance of survival. Call emergency services, put it on speaker, and start pushing on their chest. Hands only, no mouth-to-mouth needed. I want to be crystal clear here because this is the part that freezes people. You do not need a certificate, you do not need training, and you do not need to give breaths. For an adult who suddenly collapses, just chest compressions on their own work as well as full CPR in those first crucial minutes, and it can double, even triple their odds of living. Here's how. Push hard, push fast, right in the center of the chest. About 2 inches deep, 100 to 120 pushes a minute. And the trick everybody teaches, because it genuinely works, push to the beat of Stayin' Alive. Yeah, the disco song. That is the exact right tempo. And don't stop. Not until help arrives or the person wakes up. And the very last myth, because it's the one that makes people hesitate, most people push way too softly because they're scared they'll hurt them. Listen to me. A cracked rib heals. You cannot make things worse for somebody whose heart has already stopped. The only real way to fail them is to do nothing. So let's tie it all together. Most chest pain isn't your heart. The sharp, pokeable, breath-catching stuff is usually fine. But deep pressure that won't quit, the kind that comes with sweat and nausea and dread, that's the one. Don't wait it out, don't drive yourself. Call for help first. Unlock the door, sit down, chew an aspirin if it's safe for you. Cough CPR is a myth. Forget you ever saw it. And if someone drops in front of you, push hard and fast to stay alive, and don't stop. You don't need to be a doctor for any of this. You just need to know it before the moment comes, so when it does, you're not bleeding away precious minutes to fear or doubt or some myth you scrolled past once. Because it was never about being a hero. It's about knowing the difference. And now, you do.